Here.
Michael Gear on behalf of probation.
Here.
Defense bar. Honorable Clerk of Court, Jean Marie Christie.
Here.
Judge Keppel will be joining us shortly. Chief Judge Scott.
Here.
And David Sweat. Here. And I know we have a couple of folks who are kind of in a middle status, but I'll go ahead and acknowledge you anyway. Mary Singer is matter of paperwork, so we'll make a member out of you in about 2.5 hours if you're free. And Eric Jackson with us, also not officially on to my knowledge, but thank you for being here with us today. And Brent, you are currently behind a shade that is not on purpose, but I wanted to recognize you. Thank you all for being here with us today. Has everyone had a chance to review the agenda? Any corrections that you'd like to make? Otherwise, accept the motion on the August 1st minutes. Just gonna merge those two.
So moved.
Thank you, Councilwoman Ullman. Any discussion of agenda or minutes? If not, all in favor? Any opposed? Fantastic. We'll go ahead and begin with the chair's comments, and I'm going to start with letting Regina offer her take, and then I can offer my take, but just to give a little bit of context, Regina, as department head for Justice Services, and I went out to a conference of the National Network of Criminal Justice Coordinating Councils. That is a heck of an acronym, but the long story short, these folks work with people who do their own versions of JRAC throughout the country, putting together some of the best minds, folks everywhere from California and Las Vegas all the way out to the mayor of DC's office, and had a lot of wisdom to offer us of how we navigate public safety and criminal justice issues in a very tumultuous time, using the best words I can there. So Regina, if you'd like to offer your takeaways from that, I'm happy to follow up.
Okay, well, I'm a member of the executive committee of this group, and we put out a national best practice guide to operating these types of boards. And it really talks about policies, our practices, how we should be navigating the system, and best practices in doing that, and the membership and all of the bylaws and communication plans, all of that stuff, and collaboration within the system. So we had a great turnout of folks in Nevada. Nevada hosted because they were doing some innovative things out there. We were great to get Martin to come and join us so that he can see how many of these sites are operating. They're all struggling and have their struggles, but they're operating really in the context of what they can. As you all know, each of our units within the system can have its challenges, but they're doing some amazing work out there, and they showed us. We had some of the judges that did presentations and talked about their engagement, their commitment to the work. And it's all a work in progress. And I think that was the beauty of it. We do have an opportunity for them to come and to do some assessments of our JRAC and to decide, how we're working, what we can do to improve. It's at no cost to us. And they would help us to build our JRAC to a model where it's best practice. So make some recommendations. And then Martin was navigating everybody. Okay, he was working the room. I was proud. I said, okay, look at welcome. So your take.
I think it was a fantastic conference. There's a lot of wisdom about what areas we can improve. And that's not a slight at anything that we've been doing, but again, the unique challenges surrounding funding, many of the things that I think we have going the right way in our county involves re-engaging our key partners, having people at every level of government, having a strong relationship with the folks in the courthouse, and being responsive to the needs that we're hearing from the people who have the data, and just bringing us back to a data-focused approach of what are the needs that we're hearing from our court partners, and how do we address those safety needs with information from the people who are actually doing that work. So a little bit of those rare moments where I'll get to say that the county is going to take its hands off a little bit and be receptive to listening and figure out how we can solve problems together rather than being an advisory, like you have to do this. It's a collaborative process of hearing from people at every level. And I think we made a lot of headway as far as our county goes in re-engaging the key people we need there. We are not having the engagement issues that other communities are having. So I'm thankful for everyone here because we cannot do this without having our law enforcement partners, having our city, having our judges and the bench and the clerk and the DA's office actively participating in these conversations to figure out what are going to be the areas where we can have a meaningful impact, and then do something meaningful to move the needle on what public safety looks like in our specific community rather than just following general guidance that you might hear from national best practice. And even whether or not those words are best to use at this point. So we're looking forward to sharing some of those recommendations today. We just want to kind of level set, share where our data is coming from, who the people are, and when you see a new face in the room, these are folks who are here and willing to help and not to judge or tell us what to do, but really just to figure out how do we better utilize the resources that we have and deploy them in a way that's actually going to make a difference, rather than focusing on theoreticals that might work elsewhere. Any questions? Great. Addressing old business, Just Home update.
Update here.
Apologies.
Just an update on, we
please.
attended the NAPSA, the National Association of Pretrial Services, which was a well-attended, it was in Atlanta. We had a well-attended conference. It was very informational for us to see how other operations were other agencies and across the nation were operating pretrial services. We got a lot of insight, so hopefully we'll be able to make some improvements there. That's it.
I'll offer a special thank you to Regina. She went above and beyond and was participating in all parts of this. I did not even know about the second conference, so she is moving and shaking throughout the country. Max, I'm sorry to pull you up early, but if you don't mind sharing with us the Just Home update and what our position's been on that.
Hi everyone, for those who don't know me, my name is Max Tainter. I work for a department called Strategy and Innovation at Buncombe County, and I'm acting as sort of the county's project manager associated with Just Home. I know that you all know what Just Home is because Sybil told you a little bit about it before, so I just want to give a brief reminder that it's the MacArthur Foundation's program. Buncombe County was selected from one of a very small number of counties nationwide, and their goal is to expand safe, affordable, and supportive housing to reduce recidivism driven by housing instability from people who are incarcerated or formerly incarcerated. So how are we going to do that? We need to have a plan. We have two great contractors that we're working with to do community engagement. One is Change Matters, who has actually worked with MacArthur on this specific grant before, and one is Thrive Asheville, which is a local organization that can really connect that perspective to what our backyard looks like associated. What does it look like? What is our landscape for this, and how can we engage our community with doing this? And that's sort of the name of the game with what the county is doing with this. MacArthur wants a report from us in December associated with what are we going to do with the potential funding that we might get from them associated with this project. So we're going to create sort of a document landscaping what we look like, what we planned on doing with the money if we were to get it, and how we're going to impact the community based on like what our landscape looks like. So the first thing that we did was we created a community advisory council made up of plenty of organizations that I'll show you on the screen in a second. But the community advisory council is basically guiding our engagement strategy and providing input to the engagement strategy. We're basically showing them where we're going to go, who we're going to talk to, what kind of information we're wanting to get, and we're looking to them to guide us to avenues we might not be thinking of, to paint a better landscape associated with what kind of the infrastructure is with Buncombe County in terms of what services we have, what is the experience with those, what's missing, and what can this funding help sort of reinforce further. So we're doing targeted meetings across the county, interviews with people who are currently incarcerated and formerly incarcerated. We have 4 community advisory committees meeting, and just to preface, this is normally a 1.5 year or longer process, and we have like 3 months to do it. So I might be asking for your all's help once we get these surveys final to spread them through your networks and help us paint an even more detailed picture. We have posters at our libraries, and we have 4 individual surveys because we're kind of looking to have discussions with 4 different audiences. One is people with lived experience with incarceration. One is just for the community at large. One is for service provider organizations that support formerly incarcerated individuals in our community, and one is for the loved ones of individuals who were formerly incarcerated. We created our timeline of what we're going to do with the engagement and when it's due and what steps across the way, and we're gathering a lot of data for what we have for incarceration and housing and making sure our goals are aligned. So with that said, I'm gonna go through one of these really quickly. This is our engagement board. We had our first meeting last month. It was very well attended. Some people in this room were there. But I'm not gonna go through the whole list, but there's representation from a lot of different organizations. And if there are organizations that aren't on this list, we are definitely making sure to reach out to them for the engagement aspect of it. But this is kind of the group guiding the engagement that we're doing. Next is our timeline, very condensed, as you can tell. September, we created the committee. October, this month is where we're doing, like, the surveys are created, we're starting to get them out. We're actually having meetings already with community members, and we're kind of starting and finalizing the data gathering aspect of what we're doing for MacArthur. And then in November, next month, we plan on finishing the surveys and finishing the community discussions. And then in December, we're gonna have our final meeting for the Community Advisory Committee and submit our report to MacArthur. So I don't have to go too much into the data collection with you all because I think you all have a very knowledgeable view of the landscape of our justice-involved community. But I'm just gonna tell you what we're looking at as far as this data. We have access to the people who are going through our Justice Resource Center. We have access to data associated with people that are incarcerated through our Apricot system. We have point-in-time surveys. We're gathering data from people right now. We have homelessness data or unhoused data for the city of Asheville that we're looking at too, just because housing instability is also part of what we're looking at. And we're also going to be using what you're going to hear about soon, our touch points associated with the SIMS building, which is sort of a data landscape with what our community is right now, because you can't make a change in our community if you can't prove that you've made a change in your community. So we're trying to get all of our baseline data right now associated with, hey, MacArthur, this is what it looks like, this is what we want it to look like, and this is how your money can help us do that. Please give it to us. And then finally, the goals. These are the kind of goals we've established specifically with the Community Advisory Committee and with what we want to do with this housing plan. We want to listen to those most impacted associated with housing instabilities from former incarceration, especially from individuals and from their organizations, the people who really know what they're talking about. We want to identify housing needs. We don't necessarily need a housing plan and a budget and everything associated with this project. We just need to be able to understand what the needs are in the community from people with these lived experiences. We need to build this community-driven plan, and we're hoping the Community Advisory Committee can really help guide that. Then we want to pursue the funding. So when we submit this report, we may unlock up to $5 million for this initiative. It's not guaranteed because nothing's guaranteed associated with this. However, even if we don't unlock that $5 million, this is valuable data that we're gathering for Buncombe County that can help us potentially inform future affordable housing program work that we're doing, or just a plan of action associated with future planning. So yeah, it's solid information and a solid view of the community regardless of the outcome, but we're still hoping that it's going to all work out. Anything that I'm forgetting from?
Yeah, I'll just mention too, in case you're wondering about the truncated timeline, the reason we had to speed this up into hyperdrive is because of Helene.
Helene, yes.
So we obviously, I think we'd had one kickoff meeting before Helene hit, so that's the reason we're moving so quickly. But I have confidence in our team that we're gonna get a good foundation of data. And yeah, so just wanted to make sure y'all are aware that that's the reason we're doing that.
The work's going really well.
If you were to unlock the $5 million, does that $5 million cover construction of new housing, housing vouchers, or is that a plan that the county would have to submit on how they use it?
It's kind of a plan, I think.
It's gonna be, yeah, it's gonna be more capital, so I would vouchers, no, but construction costs basically, yeah.
So just to level set for folks, this has been, and Councilwoman Ullman could certainly share her perspective from City Council, but this has been an area where we've severely lacked funding, or at least unrestricted funding in a lot of ways, and having unrestricted capital funds for a project like this helps us kind of focus on root cause issues affecting our justice system without some of the stigma that might come with otherwise talking about polarizing public safety measures. Everybody knows we need housing. That's not really a debate in our community. It's just what that's going to look like. So having a plan and money for capital projects like this seems exciting. And to the extent we did not have some members here who were otherwise involved in the advisory committee, is there a way for us to funnel feedback to you, to folks in the
Yes,
county? How
so-
does that look like?
What I'm going to do is after I present, we're at like 95% done with these surveys. Once it's done, I'm going to make sure you all have access to it and it has a landing page for which survey is most appropriate. And we really want you to send those through your networks also.
And just to add to what everyone's saying, the whole point of this is not, we've been very purpose and intentional in that we want this focus to be on what is needed, not the design. We need one building or this type of housing. We don't want to get into what that looks like. What are your needs, so that then whatever we build, it will meet the needs. It may be a multiple number of houses, a number of units, maybe a one building, but it'll be based on the needs. And that's why we want to hear from everybody, particularly those most impacted, but everybody that touches that system, so.
And for who?
Right.
Locations potentially
We
identified.
ain't looking, that's what we're trying not
Yeah.
to get ahead of ourselves. Everybody was there. All we want to do right now is what do you need? If we were to build something, what would it look like? Who do we need a one bedroom? Do we just need, what do we need? Cause once we know that, then we could now go out and find something.
Any questions about the process or what comes next?
When will we know if we get $5 million?
Great question.
That is a great question. We're submitting the report by the end of December, and you know, that's as far as I know.
Yeah,
that's
as far as we know.
Yeah, so
We're meeting.
that's one of the other reasons why we're trying to go as quickly as possible, because not only did it throw our timeline off for the planning project, but now MacArthur's waiting on us. So it's thrown their timeline off for the capital piece. And so they're working on, can they extend that for spending the capital? Because they have deadlines to meet too. So that's the other issue.
So this is a very aggressive plan that we're doing. But we've got a good timeline. I think we'll be able to make it.
We're on track so far.
Yeah.
Awesome. Well,
If
thank
you
you,
have any
Max.
questions, you can reach out to me. Thank you.
Excellent. Well, we'll move to our subcommittee reports. For newer members, we have a couple subcommittees. You can come on up, Victoria. But the one that we're going to hear from today is our Behavioral Health Justice Collaborative. I highly encourage you to steal Victoria for whatever little free time she has to find out more about that work. But today we're going to get an update on sequential intercept mapping. Did I get that correct?
Sequential intercept model, and we did a mapping event, but I also corrected myself on that recently, so no, thank you. I'm Victoria Reichert. I'm the Behavioral Health Manager for Buncombe County. I'm tasked with coordinating and collaborating between county departments and our community around behavioral health needs. And I also just want to do a quick moment to just say thank you to our elected officials, our judges, and other of our partners that were part of the first annual WNC Recovery Rally. It was a great turnout. There were lots of connections being made. I think even in the moment resources connecting with folks. I remember a gentleman kind of talking to who was early in recovery in a recovery house, kind of talking about what is this all about? And I said, you know what? In a couple of years or in next year, you might have to be behind the table and giving hope. And you could just see his eyes light up of like, okay, there is a future. So I just want to, again, acknowledge partners that were part of the planning and being part of that event. And I'm going to talk about what the BHJC is. And just as a reminder, we are an advisory committee for the JRAC. This is a room of folks in the behavioral health, substance use, social service that work with folks that may have justice involvement and who are interested in kind of finding those solutions to the various problems. And so on the next slide, I'm gonna just touch on the sequential intercept model, where we did host a mapping event on August 28th and 29th. And again, I think several of you that were able to participate in that meeting and to provide some feedback. This just kind of gives you an outline of what sequential intercept mapping is about, or the model is about. You have different points of intercept that someone may interact with the justice system. And what's really neat is a while ago, this intercept 0 was not included, but that was something that was really identified. How can we actually prevent the interaction with the justice system? And so when I move forward, not yet, but you'll see some items or services that are available at every and any intercept. And so it's not always just like black and white, it just stands in that one piece. But it's an opportunity of how can we divert individuals with mental health, substance use challenges to alternative services. And that really aligns with the Behavioral Health Justice Collaborative. How do we make sure they're getting the right resources at the right time at the right place? So we'll go to the next slide. As part of the sequential intercept mapping, we went through in each intercept identifying resources that were available. And so what I've put on here are just the gaps that were identified and voted on. So there were more gaps maybe identified. And the numbers in front of that are just the number of votes that we received. We probably had about 45 participants from a variety of backgrounds and experiences with lived experience. And so our community services one key need was around hospital coordination, making sure we have strong relationships with our local hospitals and the mental health and substance use services. And I'll go in a little bit more detail, but I'm gonna kind of touch on some of the things that won't be on the next slide. Ironically, expansion of community response was not necessarily identified as a gap, but got the most votes. It was identified as a new service, but we learned that only 6.5% of all behavioral health calls are being responded by our current co-response team through the Sheriff's Office and in partnership with VIA, through a state grant and RHA. I think as we all can agree, more trauma-informed care is always helpful. Adolescent and youth services around substance use is a gap in our community. We are continuing, I know VIA is working with a provider, Clarvita, to provide a substance abuse intensive outpatient treatment program, but looking at more of those services, again, as part of that prevention, right? Our young people become adults and they may get involved in the detention or the justice system. How can we prevent that? There's opportunities on how do we improve the 911 system and connecting with some of our behavioral health services and resources. There's very limited treatment options for dual diagnosis. And really looking at that of people who may have polysubstance use. So someone who may be using a stimulant, but also within that is an opioid, and how do we help provide someone that treatment, meeting them where they are. Data sharing, as you see, comes up in two places, and I want to be specific, and I'll talk more about it, but this is more about sharing individual client information between treatment providers, between programs that are doing that outreach to, again, help understand where people are maybe falling through the cracks, what are opportunities to collaborate with one another, and again, to meet that person where they are and what they need. There's also opportunities to embedding peer support work. I know in our pre-trial, we have peer supports that are doing some of that work. And I remember one thing that I noticed, a pre-trial case manager was showing up at Haywood Street Congregation, where a lot of people may show up. Let me meet you there, let's do that check-in. And I'm sure that was probably part of their lived experience of knowing, hey, sometimes it's hard to come to the courthouse and let me meet you where you are. Another thing I wanted to just touch on is around Medicaid. This was identified as a need, making sure people have Medicaid, getting connected to resources before they leave the jail. But we also talked about the upcoming changes with Medicaid, with certification having to happen potentially every 6 months. the demand that will be on our economic services, on recertifying folks, and how can community partners, our social service agencies, help people with that process so that they can get their applications done quickly. There's not a lapse in services. So while you may not see it as a big priority, it's something that we don't want to lose sight on because that's going to have an impact on our justice-involved youth. Not youth, justice-involved vets. And let me just see, I think, something that was identified is some folks aren't feeling comfortable going into the courthouse to get services. There can be trauma from being in those places. How do they access those services? So those are opportunities to how do we, again, meet people where they are, where are they already congregating, and how can we provide those services? And then obviously housing is a big one. And as Max touched on that, there's some work in the progress, and I'll touch a little bit more on that. The other piece about community supervision, the catchment area, it's such a wide variety. So we have our detentions in Buncombe County, but people are coming from other communities. And some of our other counties don't have the robust services that Buncombe County has. And so that can be a challenge in getting folks connected to services, getting them back to their home community, and it can also be a burden on the supervision of being aware of all the services available and getting folks connected. Any questions or anything that I know some of our folks that were part of the SIM or at the BHJC that you'd like to highlight, anything bold, I'm going to kind of touch on a little deeper on the next slide.
Just a part of the part when we talked about, and mental health was a big component, and that they spoke a lot of options, mental health options, diversions to divert people who are dealing with mental health issues away from the system. So that's why you see mental health caught up there, but they were also talking about other diversion options. And then they talked about some of the challenges in the jail with individuals getting medications.
Yeah, there was some formulary within the jail that there are some medications, typically your more controlled substances, but may address anxiety that are not on the formulary in the detention, which again could be an opportunity to maintain someone's medication that's working. And so that can also be an opportunity that we can look at. Thank you.
I think just going back all the way to zero, the co-response. We had a very robust discussion, at least in our last meeting, about a lot of us look at co-response, but the reality is we only have a couple of people actually working in co-response. And so the disparity between the need and the resources devoted to it was at least an issue we discussed quite a bit.
Yes. And we'll maybe move to the next slide.
For a whole county.
Yes, yeah,
So
and I think,
let's just break it as 2 for a whole county.
and so I'll touch on that a little bit more. I think one piece that was even talked about, how do we institutionalize this service? It's a service that was talked about back in 2017 with opioid settlement funds. We were able to partner with community paramedicine. The sheriff's office had some will using those clinicians to pilot, seeing lots of great progress happening. Again, VIA applied for a state grant, partnering with RHA for the mental health clinicians. We were able to expand. But in terms of hiring and expanding, knowing that it's a program that is part of our county and is a value within our county is a piece that is a gap, right? How do we make sure it's institutionalized? And I could really, go into more details about the various opportunities of how do we partner with mobile crisis? How do we partner with other municipalities and their law enforcement? How may they want to identify a officer to be a co-responder? So there's lots of opportunities, but I want to just highlight the big pieces. Is this a service that we want in our community? And we want to sustain that so that when our law enforcement officers take that risk to do that new job, that feels good job, that they can feel like this is actually a movement forward and I feel secure in doing this work. But it's such opportunities and would love to even share some of those stories. So if anyone, Sergeant Freeborn would be great about those opportunities when you have mental health and law enforcement together at times to identify both sides of the table. So while someone's mental health needs are being taken care of, they're also recognizing they've got parole. Let's make sure we're communicating with parole and that this, what happened so that they're not facing further, penalties within the justice system. part of, even we talked about mental health treatment court, and would love and appreciate Judge Keppel being part of the BHJC to just kind of provide that judge perspective. Really being able to explore what are those opportunities, maybe what are some small lifts that as we're building up to looking at a full treatment court, partnering with our co-response teams, I think there's gonna be some great opportunities in making sure people are diverted. The challenge is there's not enough diversity of treatment beds. We have lost in our JFK Aid Act is now serving 50 counties. We had 3 programs within the state. There are now 2 programs. One's out east serving those 50 states, and the need has not changed. And so there's not a lot of treatment bed options, especially low barrier treatment bed options. And this kind of ties in even with affordable housing. We know there needs to be affordable housing, but when people are returning from incarceration, where are those options for them? You have people that don't have a job, are not maybe up to date with their skills. They don't have maybe their ID, Social Security, all of those things. How do we start planning at the booking phase on what their reentry will look like, what housing opportunities are? How do we wrap around them so that we're able to get them stable, get that Social Security, get that job skills, get that job. So when they then find their own independent, maybe recovery house, they're not stressed about, I need to pay next week and I don't have the funds. Because what is the potential? They're gonna resort back to unhealthy ways, ways that they had coped in the past, because that's right what you're most familiar with. And without that wraparound support, that can be very challenging. And I did touch on the real-time data sharing. This idea is, what's this look like? What would a platform look like that I could see if I'm meeting with someone and they're saying that they're with community paramedicine? I could see that, okay, actually you started buprenorphine. Let me get those connected with you. Let's get you restarted on that if that's your desire. We find that in the field, our teams are already trying to coordinate and helping find where's that individual. Oh, I saw them last week. They were down by this railroad tracks, wherever that might be. And there's some opportunity that if we're able to get that real-time data sharing, again, a conversation that's been happening for years, but I think it's opportunities on how we're systemizing our crisis response system so that we are able to really point out who's at the table, who's connecting to who, and sharing that information for the benefit of our justice-involved youth and others. I keep saying youth, but any questions that you all have? I want to just highlight, these were things that were identified in the sequential intercept mapping event. We do have the final report available. And these were just things that the Behavioral Health Justice Collaborative felt like, yes, we agree. We may not tackle all of them. We may partner with our courts and judges around mental health, making that connection to our mental health providers, and just being partners in that, same with the housing. How do we look at treatment opportunities and low barrier options, et cetera. But I hope this gives you all a little bit more insight into some of those priorities as you all begin on strategic planning, but happy to answer any questions.
What do you think is the most likely of the recommendations to gather steam and move forward towards implementation?
I think there's will. Are there the resources available? I think that's going to be the challenge of implementing. So we've been like crisis response, right? I think we can get creative. We can maybe have some small wins that are low cost or maybe not an additional cost, maybe something that's already in the process. The staffing piece is going to be a challenge. It's going to cost to increase vehicles. I think in our budget kickoff, we're talking about maybe $75,000 approximately to outfit a sheriff's office vehicle. But again, are we creative in spreading that need with our other municipalities to say, what do you want to bring to the table? How can you serve your community and connect to those crises? Same with treatment beds. It can be a lot to do and the financial cost to get things started. But I think there's still opportunities of what are we leveraging what we have currently? How do we make that more accessible? Because there are grants. So for example, we do have a grant from NC Commerce to help expand Transformation Village with dedicated units for women and children in recovery. And how do we then support getting people into those beds once they are built? So the likelihood, it's hard to tell, yeah.
It's a trick question, I was just
I
curious,
know,
I
yeah.
mean, but
Well, I
yeah, I
think-
just was curious to see like, oh, this one's already at, like, sometimes stuff is bubbling, like, there is some momentum, the resources is always, so, yeah, thanks for playing around with the
There's
question.
bubbling, I think there's opportunity.
Yeah. But from my recollection, there was like no low-hanging fruit. We
Yeah,
were like,
also
oh,
helpful, yeah.
this is so easy, let's go do this. It was some really big ideas. But I will say, you know, from my recollection too, correct me if I'm wrong, but housing was the number one priority
Yes.
that came from that. And so the Just Home project is very timely, because we are gonna hopefully make some headway, with that, so.
That diversion opportunity and
Yeah.
giving people a good landing spot after return is gonna be crucial.
Yeah, I just think, to Victoria's point, is there's a lot that was on, that we discussed and that are needs, and that are happening. But we have to look at how do we leverage those resources. Because if we look at like the co-responder, we know many of these people have mental health, substance use, they're out in the community. And we talked about diversion options. How do we better support that? How do we better look at how we're utilizing resources? Can we move things around? I always say, you know, like with me, I'm doing renovating. I'm just moving things around. Don't cost me too much, but if I move it around, I can get more just moving things around a little bit. And so that may be some of the things that we look at as a committee here and say, how could we perhaps best move people, maybe people around, doesn't change. I'm not asking for any more money. I'm just gonna move this person over here and help make this happen. And then that's some of the things that we have to look at for recommendations. So maybe that's how we do some of this, and not causing us extra money, just causing us to rethink how we look at situations.
I'll just say from my perspective, there's multiple things on your wish list that we already have
Mm.
in the pipeline that we're working on, the Forensic Act team, the co-responder stuff, the housing program. So those are all sort of already in our pipeline and already have identified some funding to support the startup of that. So those things aren't sort of, at least in my mind, wish list. Those things are happening as we speak. The staffing is the biggest challenge we're hitting. It's slowing the process of getting any of those services online because the available clinical staff in the community to actually do that type of work. In the clinical world now, we have a lot of clinicians that love sitting at home and being behind a camera versus out getting in the field and getting their hands and feet dirty, working with people. And that has caused a lot of challenges, especially with state-to-state portability now. You're licensed in North Carolina, you can work in Tennessee, in South Carolina. It's opened up doors for our clinical people to walk out of North Carolina and do that work elsewhere, and it's really caused some significant gaps for us.
And that might be helpful for us, so Don, is to be able to, for this group to kind of see what those things are in the pipeline. And then, yeah, because then that way we can see how maybe there's a linkage that we could make it, take it to another level if we knew how it's operating. That might be a good idea, if maybe you can come back and share
We can make that.
before you leave, before December.
That'd be great, just
Yeah.
understanding the pipeline, I just don't, I have a lot to learn.
Yeah, and a lot of it is informative. So in your guys' work group, these ideas come up.
Mhm,
We're
mhm.
sitting at the table, we're talking with the people at the Department of Health and Human Services, and we're like, because sometimes they need to spend money. We're like, hey, we got a program here. If you send us, $500,000, we can lift in 6 months. They're like, here, get this money off our plate. They send it to us, we make it happen. So knowing the needs allows us to communicate those up to where the people that do have the money
Yeah.
can get it back down to us.
And I appreciate you all for opening up the SIM, because it was initially supposed to be just looking at women, and they opened it up to do a community-wide one, which was amazing for us. It kind of helped us with the Just Home. But even with that, and you're talking about some of the things that you all were doing with housing, even with us knowing some of that, how that could be a great leverage, because we're talking about just services to the people with, not just housing, but what services need to come along with that. And that would be having us that high level big picture to see it. And we can see where we can pull resources. That is what I think would help us catapult a lot of our needs if we all see around the table how we fit in.
I agree. I think there's opportunities for us to leverage each other's value in that too, between Dogwood, Via, the county. If you go to MacArthur, whatever, and say like, hey, Via's throwing in $4 million, like, you know, can you match that or whatever? And you go to Sabine, Dogwood and say, hey, MacArthur and Via's throwing in $8 million, can you match that? We can turn that $5 million into $15, $20 million much quicker than us just doing our own little project.
Exactly. And I think if we look at it, and that was a whole lot of conversation we had in the sim, is that there's a whole lot of work happening, but the gaps is this group doesn't know this one is doing it and there's no connection, and then you got restrictions that we've placed that we can't do. And if we can work through some of those things, how much work could we get done? And don't necessarily cost a lot of money. Like I said, you just move a little chair over here, where it used to be over here, you move it over here, make it look a whole lot better and a lot more functional. If we could think along those lines, we could get a lot done.
All right, thank you all.
Thank you, Victoria. And as you all know, this is gonna be a continuing conversation. There's no magic solution for us here, but it's great that we have people engaged at the VHJC level and bringing up these recommendations and ideas of what we need to prioritize, and setting those priorities will be the fun, I use the word fun loosely, challenge for what we do next. So we'll move into new business. I'm going to ask that unless anyone is burning to discuss the vice chair nomination, let's save that for another time. I know some people have to go at 1:30, and jump right to our 2-year strategic plan proposal, where Lee Creighton will lead the civil.
All right. Okay, so good afternoon, everyone. I am going to talk strategic planning today with you all, and there is a different setup, and we're going to get into why there's a different setup here in a minute. Because we're going to actually start to put some ideas up on a wall and get your feedback on what priorities you all would like to focus on over the coming couple of years. But before we do that, I just want to kind of review where we've been with strategic planning in the past and talk a little bit about where we intend to go in this next go round. So there is a strategic plan for JRAC. There was a 2025 strategic plan that was developed. It was developed in 2020. That plan is available on the JRAC website. If you have not seen it before, there's basically the plan includes 3 strategic areas of work that members of JRAC at that time wanted to prioritize. Those were diversion and community wellness, collaboration and community engagement, and equity and resources. Overall, that plan included 7 goals, 15 initiatives within those 7 goals, and then 44 actions within those 15 initiatives within those goals. So the plan is very expansive, a lot of work that was highlighted and prioritized. And there certainly were some accomplishments that were achieved over the last several years. We have a full accounting of the plan and a document that we can certainly make sure that you all get if you're interested. Just highlighting a few of the key accomplishments that, as we were reviewing the work that had been done, implementing this community safety program, and so that now operates under Justice Services as the Community Violence and Prevention, Community Safety and Violence Prevention Initiative. We also worked with Fiscal Legal to expand expunction services, and then using some Safety and Justice Challenge funding, partnered with Fiscal Legal as well on a driver restoration or restoring driver's license program. And then a number of agencies within the JRAC membership also have some public-facing dashboards to promote transparency about what is happening within the justice system. So when we looked at the plan overall and tried to really determine, well, what did we achieve? What can we say was check? We did that. 10 of those 44 actions, we felt we could really say check mark. The bigger pot was actions that we worked on and maybe weren't able to see to fruition, or there's still work going that's underway. And then we also had a bucket of actions that just quite frankly weren't addressed. And we didn't have any work that we could point to. So that's kind of where we're at with the 2025 plan. You know, it was a 5-year plan, again, developed in 2020. So time is now to create a new one. So I want to talk a little bit about what we're proposing in moving forward.
Before we go on, I
Absolutely.
just want to note that for folks who were involved in that plan, I don't want anyone to feel that, you know, that just because we didn't get everything done, that it, you know, it was not a worthwhile effort. I also want to point out that that plan was being written in 2019, and then we had COVID in 2020, and then we had Helene in 24. So there are reasons why we probably did not achieve as much as we wanted to. So I don't want anyone to leave here feeling like, you know, it wasn't a good effort.
I do strategic planning professionally. That was impressive. Like, it's I've never been in a cycle with a client who's ever completed their entire strategic plan.
Absolutely.
So I think that's pretty powerful.
Yeah, and a lot has happened in the last 5 years. A lot's happened.
Wonderful ride.
All right, so what we really want to do in this next iteration is really promote what feels feasible, right? And so with that in mind, what we're kind of transitioning to and proposing is that we look at the next 2 years, right? We learned a lot can happen in 5 years. Let's kind of pare it down, say next 2 years, here's what we want to focus on. What we're going to ask you all to do as members of JRAC is to really brainstorm really thinking at system level, like what are your strategic priorities? And we're going to use those as like what our goals will become, right? And so you all will be working on developing that piece of the content. And then what we'll also ask you all to do is to assign those priorities to some entity that will be responsible of moving that work forward. Now, that could be an existing work group or subcommittee that is already operating under JRAC. We might need to create some, right? There might be specific offices or agencies that really need to take lead on some priorities. But you all will be identifying at that priority goal level who will be leading the work moving forward over the next 2 years. Okay. The other thing that we're going to do that's going to be a little bit different this time is we're going to work to develop with you all a metric for each of our goal or priority so that we can track progress, right? So that we know kind of have a better understanding of how we're doing during the plan as we move forward. So this is just a slide where we've got an example of what the proposed structure would look like. In this example, it's just, we've got 3 priority areas. Under there, you might have a goal, one goal. Under another area, you might have 2 goals. But, you know, for each priority area, we're looking for a goal. We're looking for who would that lead group be moving that work forward, and then what that metric would be that's tied to that priority. Any questions about that?
How many goals are you looking for?
Well, we'll talk about that. We're gonna put some things up on the board today and get some feedback. And that's gonna be a question that I ask you all, like kind of you're gonna hear from me is over the next 2 years, what is feasible, right? What can we what can JRAC say? Yes, we are committed to these priorities and move those forward.
Yeah, so I just appreciate this approach. I think, you know, for years we've sort of operated kind of like, hey, this is the problem, and we've thrown stuff at it. But we haven't done a really good job of measuring our solutions in a way we know whether the things we've thrown out there are actually working the way they need to be working, or they need to be tweaked a little bit to work better. And so I definitely applaud that the goal is coming with a metric that you come back to this group to say, yes, we did this, and yes, it's working or it's not working, and we need to tweak it a little bit or do something better with it versus just going out there and grabbing the next shiny pan.
That. Any other questions about structure?
When you say put stuff on the board, what do you actually?
We're gonna get to that. Got some things.
Is it the mystery sheet
It's the
over
mystery,
there?
it's the mystery sheet. So before we get to that though, just to give you all a sense of what our goal is in developing this strategic plan. So we'll have several touch points with you over the next couple of meetings. In the off months, we'll also be checking in with the steering committee just to make sure things are moving forward as we had hoped. So today, what we're really looking to do is identify those priorities, right? And I'll be back in December. At that point, we're really gonna be talking then, okay, we've got our priorities. What are some metrics that we can consider? And then also assigning that accountable entity that will be moving the work forward over the next 2 years. And then February, what we hope to have for you all is that kind of final draft of the plan that you have to review, and then making resolving and adopting that plan in February. So, questions other than what is this board? What I'm gonna ask us to do, so I think we can consolidate down to 5, like maybe tables. So if we have 4 to 5 people at a table, that would be great. Some of you all, we sent out a survey last week ago. We got some responses, so thank you all for those who were able to provide some responses. We've been having conversations over the last bit of time with membership. We've also talked to subcommittees, staff that support the subcommittees, collecting ideas and priorities that for consideration. And so I have those typed out here, and I'm gonna put them on, if we can again kind of move down to 5 tables. And I want to ask you all to take a look at this group of priorities. There's about 20 of them in the packet. And there's also, you'll see blank paper. And so if you all have things that you think are missing from these priorities, you have an opportunity to add them to the board. But what I want to ask you all to do is identify over the next, we're going to do this in 8 minutes, 2 to 3 sheets of paper that you think, hey, you know what, yes, this is something that JRAC needs to do and needs to focus on. It feels feasible over the next 2 years, right? And it needs to be a priority in terms of making some type of improvement to the overall justice system and the areas that are impacted by it, okay? And again, if you see something that's missing, you can add it with the sheets of paper. I'm gonna ask you all, I'll give you about a 2-minute warning, and then what we'll do is put them on the wall and start to talk about what you all see as the work that needs to be forward.
And then we're gonna sort them into categories.
We're
and
gonna-
have the plan.
we're gonna try
Okay,
to.
okay.
Yeah, we're gonna see how far we can get.
I like that one.
All right.
That's the yes
Oh,
box.
that's a yes.
I agree
Okay.
with her.
That's a no file. Okay.
All right, you ready, Matt?
What is your version?
Just like an 18-wheeler.
That's all right there, man.
Cause this is like, it's like, I know, so like.
I guess if we're gonna pursue
So. Yeah.
It's still coming, huh?
What if they choose one with maybe some,
System wise, so that one is more
I would say
amount of
that we
resources
want
to
to
test.
So maybe just like,
I won't ask that.
yeah.
So we'll get tier 1 and tier 2.
Unless he went.
They have a legislation.
In addition to what we already have.
Only conversation right
Just
now.
like having a conversation.
Sure.
Look at us.
I'd say that'd be
No, we
Are you talking about the reminders? Okay.
So that would take us.
I think the law allows.
Two agencies.
They only designate.
Right,
A bit more complicated.
Certainly,
Yeah.
but.
Yeah, if you give me the, I should have a model of that already built, so if you give me,
Potentially remove.
download. We'll be able to do it. I mean, I think if the way that we did it is we made sure that the reminder, we used to in the old days, is that right? I feel like it was.
Yeah.
I'll go back and look at my file, but I think I'll have to go back and convert it to many items. There was some complication because they called it. I feel like there was like a little bit of. Let me see, let me see.
Take a look, I can easily create another
Yeah.
download.
yes.
Okay.
I need to pare down, because you said 2 or.
Just to stabilize it.
Wanna add one?
No.
To it. And
Here's
it's
the-
all encompassed. And I think they can justify that with the data. But the data, it was a pretty separate process.
All right, y'all, 2 more minutes.
Especially.
2 to 3 priorities is what we're looking for. And then you can have some backups too.
I would say that's
We're doing violence.
and just we're trying to make it hard, but we need to start that.
My perception, right? We don't have enough.
I know, what is this one?
We have.
So
that's all time in here. That's all I'm saying. You can't go to the legislature.
All right, 1 more minute, and then I'm gonna ask for.
Thank you so much.
And the state.
This is our final question mark. This is the yes file.
This is the yes, did you wanna look through, this one's really,
Yeah, I think he said.
We're supposed to have.
We're only supposed to have, he said 2 to 3 people.
All right.
2 to 3, and then you can have some backups.
Okay.
Backups are okay.
These are your.
Have some backups.
That's definitely. I feel like that, you get this. This is too. You're just gonna get.
Maybe if I change the word.
the best consistent.
You know, you don't have
You don't have.
some,
The
the reason we put that in there is that.
Right now, it's already. Here's the truth.
All right. I'm gonna refocus us up to this wall here as you're.
Yeah, it's, you know, one of the issues.
This is our.
This is an.
It should be.
These first two.
All right.
We're having meetings.
Y'all feel okay?
They play by-
There's still gonna be time. This isn't, I'm not gonna completely cut you off.
over here.
All right. Let's start to put some things up, and what you might see is there's some consistency across groups here. So who's got some that they're, is there anybody that's absolutely ready? We've got 2 to 3 yeses. Yeah, we got 2 to 3 yeses? Okay, we're your 2 to 3 yeses.
I think we got 4 yeses.
Yeah, 4 yeses.
Metrics not necessarily on the.
Okay, we can work
The
on that.
backup group.
That's fun.
Okay, all right, y'all, I'm gonna start to put some things up on this board here. If you see one that you've already, your group has identified, that's okay, and you can fill that in with another one that you prioritize, or that's.
Yeah, we'll go last.
Okay, all right, so the first priority that's going up on the board, or proposed priority, is educate youth and engage community on gun violence. Okay? Work to systematize co-response throughout Buncombe County, example, 911 dispatch of co-response units. We also have, looks like maybe increasing the number of co-response units as well. As an added, what's that?
Can we offer a friendly amendment to also have City of Asheville?
Yeah, APD is on there.
APD's on.
Yeah, absolutely. Promote community understanding of the court system through initiatives such as court watching. Partner with community engagement teams to provide domestic violence education directly to residents. All right, those were, who's next? Who's got some? 2 to 3.
Did not follow directions over here.
Okay. Continue community engagement around planning and implementation of Just Home. We heard about that earlier. Expand capacity and options for inpatient treatment beds in the county. Implement a law enforcement assisted diversion program. Implement a mental health wellness court. Increase law enforcement officer utilization of behavioral health urgent care. All right, so we've got 1, 2, 3, 4, 5, 6, 7, 8, 9 items up here.
And our table still has.
And y'all, and we've got 2 more tables to go. Much of my time. Okay, do you all see any, let's see, are there any 2 that you all see some type of relationship with between? This could be either in terms of an intent, a topic. Are you all, we want to kind of start to pair these things and group these things as similar buckets. So is there anything right now that's standing out to you all?
I would say inpatient beds and mental health support are the
Okay.
same vibe.
Inpatient beds and mental health, okay?
With that LEO, healthcare, could that be something that's kind of involved with the co-response?
Co-response.
Which one was? Yeah.
So we've got increased LEO utilization of behavioral health, urgent care, and work to expand and systematize co-response. Yeah, okay.
Also, that's mental health court related too.
Yeah.
Mental health court, okay. So there might be some,
And the LEO assisted diversion, I would say goes well with the inpatient treatment bed.
okay. Inpatient treatment beds.
Community engagement with Just Home and community engagement with gun violence. No, I can't quite read that.
Community engagement with Just Home, and then community engagement provide domestic violence or gun violence.
Well, both of them, because
Both of
they're
them.
community engagement.
Okay. Great.
I think lead would go with the co-response, wouldn't it?
Lead and co-response. Okay. All right. What group's next? Y'all wanna go last or y'all wanna go? What? And add a couple. All right, the next 2 we have up here are develop a robust, consistent, and law enforcement agency supported system for managing and effectively enforcing pretrial violations.
Wow. Y'all rewrote that one.
That's it, yeah. Does this one go with anything up here already, or is it a standalone right now?
No, that goes with the where's the lead, where's the focus?
Oh, just.
Standalone for now.
Standalone for now. Okay, work with our state level legislative body to evaluate and streamline the involuntary commitment procedures. Does that fall within any of these?
But I think that's kind of standalone.
Standalone?
Yeah, that's definitely
Okay,
But not speed.
all right. I think I'm going back here.
We have two that aren't already up there yet.
Okay.
Only when it's done.
Oh, okay.
You're still building. Makes sense.
Are they?
Let's see, this one's up there.
Okay.
If y'all have another one you wanna put up here? So this next one is explore a protocol for connecting offenders to services and domestic violence incidents when a primary aggressor is identified on the scene. So when there's a primary aggressor that's identified on the scene, how a protocol to get them connected to services.
Some of them are already on the board, isn't it?
That's not happening.
Okay, a lot of these are already happening. Like,
What's that?
Jesus. Most of these are already happening in some capacity now. Like a jail.
Maybe right here.
That's existed for years.
Okay.
These enhancements, so that's what these are.
Mhm.
Okay, gotcha.
Yeah, there could be, I mean, there's definitely situations, a lot of work's been done and being done, continuing these, a lot of these do align with things that are already underway, they just might need
A little bit.
a little bit of a lift or a little bit of prioritization, focus. All right, is there anything, I'm paying attention to time, is there anything that's not on this wall right now that people in this room have on their tables or in their brains that you think needs to be on this wall?
Expungements.
Okay, what more about expungements?
Right now, the process is all over the place, especially with the automatic expungements. The AOC is doing their part of it, but there's no order for other entities to act. And we need to find a way to try to clean up that process. And I think it would best be served by possibly community engagement with those violators to maybe use PISCA or some other legal assistance in order to help them get the complete expungement.
Like, do you mean getting stuff out of CDE when it's expunged, all that stuff?
Right.
Okay,
Yeah, local
I
systems.
understood, yeah. That would be good.
So I hear maybe there's a community engagement
Right,
component
for
around
you all
this.
that don't know,
Yeah.
right now, a lot of the automatic expungements are automatically deleted from the court's records by the AOC. But there's no official order that goes out to any of the other entities, whether it's the law enforcement agencies, the jail, CDE, to act. And so we have to abide by the state's, maintenance policy for records.
And just so you know, the only people that can see those are the DA's office, the defendant themselves, and or their attorney, and then certain people in the clerk's office, and we're not allowed to share those cases. Once they are expunged, it's as though they never existed. So, sorry.
But everybody else still has pieces, tentacles floating out there, so.
Okay,
Also need to be mindful of orders for arrest on the cases that are automatically expunged, because they can cause a big problem at the jail with people remaining in custody with OFAs on charges that no longer exist. It happens.
It does.
Yeah, that would be, within that system, because it should go away from enterprise justice, but not the county system once they've already put it in there.
It can be hard to find an expunged case, right? And yet there's an OFA floating around out there with the case identified, file number identified.
so I'm hearing there's some system pieces as
Yeah.
well as probably some
Right.
community engagement pieces.
Yeah.
So we might even wanna think about, this might be a big one that we break out, right? So we got 10 minutes, wanna get y'all out on time. Is there anything else that you think needs to be up here? Again, what does JRAC think needs to be worked on over the next 2 years to make improvements to the local system?
Driver license restoration.
Continuing driver license restoration. So sustainability for driver license restoration.
But anything else specific around that? Just,
Let's think about how much time is spent for the officers dealing with individuals when they get pulled over, and it being something's, they can't afford to pay fines and fees, and that's the only reason that they can't get a driver's license. Which leads to so much work on the front end for the officers because somebody in poverty. essentially.
okay, so is there a financial piece to that program that's missing? I'm not as familiar as I should be with that program, so is that correct? Expungement.
Yeah, or even capacity.
There's two approaches to that dependent, so you can pay the fines and fees, right? Or you can ask for them to be waived sometimes. So oftentimes, if a judgment has been entered, it's not gonna be able to be waived. It's gonna sound crazy. So typically, can I just really quick, kind of be anecdotal, right? So let's say I'm kind of out here doing my thing, and so you pull me over for driving. Like, I'm into some heavy stuff, so I don't really care about the driving charges. So ultimately, I get caught for what I'm doing. And then I go do time or whatnot, now I come out. But that stuff is still there. So the system is not really actively pursuing me for driving stuff. But now I want to get my license, and I got these driving issues. If I never went to court for the driving stuff, I'm in a better position. Because now no judgment was ever entered, so I can ask for things to get waived or whatnot. But if I did go and the judgment entered and I just didn't pay the fines, now that's the situation. And so we find out a lot of people have those fees and fines that need to be paid. And it does kind of, in some respect, become like a albatross around their neck. And you know, getting those driver's licenses is a big deal for employment and different things like that. So I said all that to say, in some cases we can ask, hey, can this be dismissed? Can this be waived? And that helps out. But a lot of times it's too late because judgments have already been entered. So now we got to figure out how to pay them fees and fines.
I would like to expand the expungement thing. This would still include expungements, but just figuring out how to best communicate between state and county actors in the court system, because we're piecemealing it, but it's really difficult since we don't operate with the same systems, to have like a comprehensive way to communicate better. Would be great, especially like the courts and the jail and the courts. Well, I was gonna say DAC, but they're state too, but locally. And that would work with like the expungements to existing in y'all's system concept.
And keep in mind, our focus really is around the systems improvement. Some of what we talked about, like programmatic things, those are a little different, and we can address those.
Absolutely. Okay. Anything else? Okay, it is 5 till 2. I know we gotta close things out. So what I'm gonna do is I've got all of these priorities on the board. We're gonna do some working with them, rearranging or further grouping of them, okay? What I'll come back to JRAC in December with is some buckets that have been sort of defined based off what we have here. Get your responses, and then we'll start talking about the who's doing this work, right? And then the how we're gonna measure how we're doing.
and the who's are all, they're in the room.
A lot of the who's are in the room.
The leads for the who's, you may need to call in a subject matter expert or two, but that's the role of JRAC, to do that, so thank you, Lee.
Questions?
And it's not one entity, it's a committee of folks that are involved in that system. So a couple of these things may fall under one committee.
Absolutely.
Address that particular area of the system.
Awesome.
Thank you. Dr. Craig.
Thank you, Lee.
All right, very briefly, because we only have 5 minutes, any member comments, anything that has not fallen into a broader category of what we discussed? And can you say it in less than 30 seconds? So.
Yes, I just want to recognize Donald Bruce. This is his last JRAC meeting. He is retiring in December. We are going to miss him, and thank you so much for all of the work you've done over the years. So,
But you're not leaving, right? You're not
I-
really leaving.
I live in Buncombe County, so I'm not going anywhere, right? The one thing I'd say is I want to just appreciate the group and all they've done really to impact Buncombe County and really support the individuals' mental health and substance abuse. Definitely a passion of mine. What I'd encourage you guys to do as you go forward is to really just look at the opportunities in this county. I think there's a ton of opportunity. There's a lot of people doing stuff that really is doing good work, but not doing it well. Let me just say that. I think there's a lot of opportunities, and I think you hit it right on the head, is that we have a lot of opportunities to do what I call system optimization. And if things would just work better than they are now, we would be so much further along in this particular county. And so, yeah, we can add all kinds of new programs, but if we don't take the time to actually look at how the current systems are working or not working to really help support people, then we're just gonna spend a lot of money on a bunch of new programs and we're still gonna end up with the same problems that we have now. And so just encourage you to sometimes take a step back, look at what you got and why what we got isn't working well enough within the system, because I think there's some really huge opportunities for Buncombe County. Thank you.
Thank you very much, Donald, for your contributions and active membership for all this time. It's been wonderful to work with you. Any public comment from someone who's not currently a part of JRAC? All right, seeing none. Any other housekeeping matters y'all want to address, or otherwise feel free to go back to court?
I just have a quick question. I'm still new here, so I was always taught when you join a board to kind of keep your mouth shut and learn what's going on first. But I just had a question and I was curious, when was the last time we had like a reentry simulation or anything like that?
Not in the time that I've been on, so that might be a good idea.
Well, yeah, and I'm glad you brought it up. I have two things up. Because the city of Asheville sponsored one and Brett was the lead in doing that. And it really is very important that the systems players be a part of that process. People who are working with those individuals, people like us who are making hiring decisions, if we understand the challenges that individuals go through, then we could have a little bit more empathy and compassion to that process. I wanna be able to do another one here in Buncombe County. We lead in one in the months, can't do another right now, maybe in 2025. But it's gonna require a lot of folks to commit to it, at least up to what, how many, we're saying no more than 75?
Well, we like about 60. We like to have it
So-
between 50 and
so-
60. It creates the
Yeah.
nice amount of controlled chaos we need.
So we work around that and it's very important. It's gonna take a lot of folks to commit to it, but it really, really puts you in a mindset to understand the challenges we in the system impose. And one of which I can tell you an example that I dealt with when I was at another agency is in social services, they had to come with their driver's license and ID, and the ID can't be crinkled and looking rough. Well, make that make sense, right? If you got somebody that's struggling, they're homeless or whatever, and it's not pristine, but those are the simple little restrictions we put in, and now we won't provide a service to them because their ID looks a little bit crinkled or we can't hardly, see it, or it's old, but still, you can see it's valid. So those little things like that. So it helps us, these are barriers that we put in front of folks that are not necessary. And so when we are here making these types of decisions, it's very important that we understand these dilemmas. So I don't know if I took more than 2 seconds. The other thing I was going to.
I just want to say too, you went to jail twice.
I did. I go check, cause see, I you know what, I'm telling you, I am truly not a conformist. I tell you, cannot tell me I can't have something that I'm supposed to have. I did have a problem with that. What was it I was gonna say?
Can I throw out something?
Go ahead.
Just for informational purposes, those of you that may not know, effective October 1st, there was legislation that was passed that anyone that in local government and municipalities that are gonna be working with children have to have a background check that requires them to be fingerprinted and submitted to the SBI. Just wanna make sure everybody knew that.
For new hire.
For new hires.
I know what it was. We talked about the JRAC and best practices and the CCJ, National Council, Criminal Coordinating Council, whatever it is, I can remember that. But they're offering to come in and help us look at our JRAC. And are we doing best practices, do an assessment and give us some feedback, and help us. It's at no cost. They have a little grant they'll give us. But we wanted to bring it to the steering committee because I think that's how the bylaws read now. And that the steering committee make a recommendation for us moving forward. But they'll come and do a presentation to the steering committee on what that entails. So I want to bring that to y'all and see if that's okay. Do I have to have that?
No.
Okay.
In fact, we don't have time for them, so everybody.